Hi, my name is Jacoby Rios and this is my practical assessment 34 hemorrhage first aid for my first aid assessments. And these are my notes on the whiteboard that I will be referring to. In this situation, it's important to wear correct PPE such as gloves and eye protection to prevent the risk of transmission of zoonotic diseases. This dog was a walk-in, so we were able to triage on the spot as it arrived. We could tell that this was a high-risk injury and requires urgent first aid. So we immediately took him out into the treatment area to perform the first aid. If they had called prior to arriving, I would have advised them to place immediate pressure on the wound with a towel or a t-shirt or whatever they had available, and keep the dog calm and bring it to the vet ASAP. This is Jim Bob, a 3-year-old Staffordshire Bull Terrier. We have placed a muzzle on him just because his injury will be very painful and he may try and bite us, so for our safety we've put that on him. To initially control his bleeding from when the owners dropped him off, they were already holding pressure, so we'll continue to hold pressure over the injury so it stops bleeding, and then we'll grab our vet wrap and wrap it nice and firm so that the bleeding hopefully stops. And then once the bleeding has stopped, we will go ahead and do a TPR, so checking heart rate, in 15 seconds counting the heart beats per minute, and then times it by 4. It is slightly fast because he is in pain, doing his temperature. He can go into shock from his injury, so it's really important to keep him warm. So we'll just put a blanket on him as well, so he maintains his temperature. After I've completed my TPR, I noticed that the bleeding has gone through the bandages, so I will remove the bandages, continuing to hold pressure, and I will grab myself some new bandages, place them on, and wrap it up again. And this time, as it wasn't firm enough last time because it bled through, I will put it a little bit tighter to hopefully prevent it this time. And once that's on, we are waiting for the vet to come out and get attention. I also have to make sure I'm checking the Jim Bob's colour and capillary refill time, as this can indicate how much blood he has lost already. As if he was pale, that is a very high indicator that he has lost a lot of blood. If he's still pink, that is a good thing and he hasn't lost as much blood. Once the vet has arrived in the treatment area, I'll walk through all the vitals and all the first aid that I have performed on Jim Bob. This is Jim Bob, a 3-year-old Staffy. He presented with a deep laceration to his left foreleg, and we have performed some first aid. We have put swabs on and vet wrap firstly, and then he had strike through. He bled through the bandages, so we reapplied that shortly after, a little bit firmer, and it seems to be under control now. And then we performed a TPR to check his vitals, and I wrote them down on his hospital chart. His temp was 38.5, his heart rate was 140, his gum colour was pale, and his capillary refill time was over 2 seconds. And he was panting, so I couldn't get a proper respiration rate, and he seems to be pretty quiet. Once the vet has taken over, I can then go and reassure the owners that Jim Bob's bleeding is under control and the vet is now assessing his wounds further, and we will be back out shortly to discuss the treatment options for Jim Bob.